Hello, it is Jen from Agent Advantage, and we are back today for this second session with Angela. She is the founder and inventor of an amazing product that I'm so excited for you guys to continue learning about. It's called Easy Pants. And through her invention and just gift that she's been able to share with all of us, it really will help for clients and also caregivers as well to basically navigate the incontinence world a lot easier. So it's able to easy on and off, and it allows the actual client to be able to use the bathroom way quicker, way faster, and allows somebody also then too to be able to have more confidence, like going out into the world and being able to really navigate smoothly, that transition from home, like I said, to being out in a more, I guess, way that the actual client then and also the caregiver is going to be able to have more confidence that the experience is going to go smooth for everyone involved. So pretty cool. But anyway, I'm so excited for you guys to continue learning from Angela today. And also we're going to be talking a little bit too about, besides just the incontinence space, but you can really utilize these as well for like different things that you need to be able to get, like pants on and off easily and quickly, for like the wound care space, or if someone has like a brace on, like orthopedic, kind of a situation, a cast, different things like that. It's incredible, for that type of utilization as well. So anyways, more to come, but yeah, I'm excited for you guys to continue learning from Angela today. So let's talk a little bit quickly though about what is Aging Advantage. So Aging Advantage is a non-for-profit organization that supports seniors and disabled adults in the greater St. Louis area. So through local grants and donations, we offer support programs to help with the effects of post-pandemic situations like housing insecurity, food insecurity, and really helping people with isolation things. And so this is like a great example of that. Sometimes people feel like very isolated, like in their homes. And, like, again, if they don't have competent solutions to be able to go out in the world, it can be very, very tricky to navigate. So, things like this, we're happy to be able to provide you guys, like I said, with the education opportunity to be able to learn. So through the partnership, we can provide educational topics like this that can really help to promote that self-care and self-resilience. And today's speaker again is going to be Angela, with Easy Pants. And we're just, like I said, excited for you guys to continue to be able to learn from her. So thank you for joining us, Angela.
I have to tell you,
This is so cool.
it's been a task trying to get into the various places. I have been for 7 to 9 months trying to get into independent living, nursing homes, the physical therapy offices, and I'm just going to keep doing what I'm doing until I get where I need to go, because I'm the only one out here in this position with these pants, which gives it's good for me, but it also is bad in that they don't understand, they don't know about the pants. It's not popular enough. Now all I need is that one person, and once I get to that one person and it's big, then everybody will want the pants. If I had an Oprah Winfrey, then I would run out of my pants every day. But
I know,
you have to get to the right person that can get you to the right field of people. And I'm in the right industry, but I haven't gotten to the right person that can help me advocate for people in these positions. I started trying to do Medicaid because I know Medicaid individuals have a certain amount of money from the state that goes into, say, a nursing home for that person to have one pair of pants, or it depends, or something every month. There's a certain amount of money, but that money, I'm told in several ways, goes into a pot of money, and that nursing home is able to disperse that money within that facility however way they want. Doesn't necessarily go to the person that's on Medicaid. Now,
Hmm.
I've never worked directly in the industry, but I've had enough conversations with people to know and to believe that that's how it works. The state gives the money to the facility, they use it for whatever they want to use it for, and it's not necessarily for the person that brought the money in through Medicaid. It's just how it is. And until I'm not breathing anymore, I'm going to keep pushing until I get these pants out. And when I stop breathing, I'm passing it on to my kids, and they can do it until they stop breathing.
I love it.
So,
I love it.
yeah,
And
yeah.
started with grandpa. No.
Right. Already started. That's right.
I love
That's
it.
right.
Well, and also, when you were talking earlier, it made me think as well, because like I covered wound care for like a global company. I was over
Wow.
advanced wound care for them for several years,
Mhm.
supporting them. But even yeah, like wound care, being able to get those things, like on and off easy, to be able to
Right.
see for dressing
Mhm.
changes, or to be able to have access, to check it,
Right.
etc. Because a
Mhm.
lot of the wounds, even for pressure injury prevention, huge. But you need to visibly, even if you have like a dressing on there, like a pressure injury prevention, dressing on there, you, in theory, what you're supposed to do, you need to be able to lift that dressing up,
Right.
like every, we would say like every shift change, but about like every 12 hours ish minimum, to be able to peek under there and see like what we got going on,
Hold
stick
on.
it back down and go. But 9 times out of 10, from doing like education at all these hospitals, all these everything, that's what's supposed to be happening. It ain't
Right.
always happening, let me tell you, because same thing again, it's just like people, it's like they don't want to have to mess with all the stuff that
Right.
people have going on. But but that's even people that have like in the hospital with hospital gowns, people even have issues doing it then. But in my brain, it's like you take that, you compound that into people who are at home, especially someone who might be like on hospice, or
Right.
kind of in that palliative care before you transition to hospice, but they're kind of starting to decline, getting a little more tired, sleeping in the
Right.
recliner a lot more, all the things that they do, all the cool tricks, later in life that they start doing. But you have somebody that's sitting a lot, laying a lot, etc. Same thing, but now they're at home and they're wearing normal clothes, we'll call it normal clothes, but
Right.
they're wearing normal clothes
PJs,
again.
even pajamas are not
Yes.
easy to get in and out of.
Yeah. And it's like, how do you look back there? How do you, check their, the butt, to be able to make sure we don't have anything going on, or same thing like back of the legs, back, just any of the areas, that you can get pressure injuries in a lot of places. But yeah, but like lower extremity stuff, it's hard. Yeah, to be able to do that. So I
Yes.
could see where, yeah, this would be like super awesome for
Wound care, I
family.
have not looked into, but I wrote a note as you're
Yes,
talking. I'm
yes.
making notes
I got
too.
you on
So,
that, lady.
yeah. So,
Yeah,
wound
that
care is definitely something I will look
huge.
into.
Huge.
Yeah.
Yeah. And again, just being able to get access quick for dressing changes and stuff, because um also, with the legs, and the lower legs, you have like the venous leg ulcers, like
Right.
but then you have
Right.
arterial, also you have all the different ulceration stuff. But also, as patients age, right, and they have the kidney issues, then they have the congestive heart failure issues, they get all the other cool bonus items, unfortunately, that some of these older people
Yeah.
get. You then also will get the pitting edema. You'll get the lower leg swelling. And
Hmm.
same thing, you need to be able to take
Right.
pants and pull them
Right.
up, pull them down, pull them something, so that you can
Right.
see the lower leg or the thigh, even, etc.,
Right.
to be able to push in and, see if it squishes, or, like just
And
how
it needs
tight.
air.
Yes.
And the air factor with
Yes.
something not tight helps the healing process.
Yeah. Yeah. Well, and yeah, and you need to be able, yeah, to see, like, is it tight? Is it shiny? Is it, what color changes? Because also too, as people get, the neuropathy and just different things like that too. How their legs kind of get like, I
I
don't know,
know.
like
I've
reddish,
seen,
brownish,
I know what you're
whatever-ish,
talking about.
maroonish-y, whatever it just gets kind of
Yes.
funky looking color wise. It's not just like whoosh, one great adorable color anymore. It gets a little strange, but again, like, you got to be able to have visibility of that stuff quick. So that would be another huge thing too. And even I was thinking when you were talking also, even like with orthopedics. huge. Because for these people, same thing, like when they have like, knee surgery or even like hip surgery, um, all the different, pick a body part essentially, but for them especially, pick a anything that needs surgery joint wise, hip down, as people age, when Arthur kicks in for
Right.
arthritis, when he comes to visit a little too much, and then you got to have, like a joint replacement or something, or just even
Mhm.
surgery. Same thing, being able to have quick
Right.
access to see the incision, get it clean, change the
Right.
dressings and stuff like that would be huge. That'd be awesome. Or to be able to have, like you were talking about earlier, like a cast, if somebody has a cast on or a brace, on, to be able to have that underneath, all that monstrosity of pants would be great for them to be able to have room. Or even like a lot of people also too, especially as they age, even if they have like a lumbar brace on, like a lower back brace, or sometimes they have like
Right.
PLSO, we call it,
Right.
which is like a
Mhm.
thoracic. They'll have like a thing in the front, essentially,
Right.
and a whole thing in
Uh,
the back, as well.
yeah.
So they'll have a brace all the way in the back, and then they'll have a brace
Uh,
like in the front, like helping to keep them up because they all, do this when they get older. So
right.
sometimes to help with that kyphosis, they'll have like a brace, but some of those things can be really big and really
Right.
robust. So
Right.
again, genius with your little drawstring situation because that brace can be
It gives
whatever the heck
room.
bulky size it needs to be, and those pants can go right around it, zip it, and tie it, and you're done. So that would be another huge area I think would be.
I'm writing all your little ideas
Take
down
down
as you're
the
talking.
notes, lady.
Like I'm in class. I feel like I'm in
Yeah,
college again.
I love it. Yeah. Okay. And then, like some of the last stuff too, I guess would be question wise from, how you said, like it's DME approved, right? That is huge. And that takes
Was.
forever, lady. I promise you. So double high five on that one. Like, holy cow,
Thank you.
that's a feat in and of itself. Good grief. Super bonus points you get for that one. But for somebody like, like because normal DME stuff, like they would carry some of that kind of stuff. Like again, if somebody needs like a walker, and by DME, like if somebody needs like a walker or a brace or, like different things, even like for older people, like their compression stockings, or just all the different things,
Hmm.
right? Grab bars, whatever. But for somebody to be able to access, yeah, like your product, do you have them yet, or do you anticipate at some point having them in like the little, I don't want to call it, like I don't not necessarily like the medical west, but like the different little rehab,
The medical supply
like the medical
companies.
supply companies, yeah, around the area. Would it
Actually
be
tried to
something like
get.
that they would carry,
I would
or how do
love
you
to.
navigate the DME part right
So I actually spoke with the chief executive
now?
um, over the state of Missouri, and she explained to me that I don't have to be a vendor for durable medical equipment, and they are classified as durable medical equipment because they can be worn again. So anything like paper products, no. But
Mhm.
because these pants can be washed and reworn, they can be purchased one time like a wheelchair or a bed through
Yes.
that independent living waiver. As far as me trying to get into the medical companies, I've had some blocks there. I'm not done, but it's hard to get into these companies that are local because I could actually give them my product and they
Hmm.
could, because they're approved through the state, have a
Hmm.
prescription for that product. But there are some other factors. So it may be that the pants have to be approved through the state of Missouri to be considered a product that can be a prescription given for. So I've had some inconsistencies on the information on how I can get this out into the medical equipment places. The majority of what I've been told was that if they get the product from me because they're already approved through the state of Missouri, that the product can be given through their partnership. But I haven't gotten that far with anybody that will give me enough of their time to explain and to work with me on that. I'm not all over the place, but I'm hitting every angle that I can to try to get these pants out there. And what I'm loving at this point is that I will tell somebody about my pants and they told me they heard about it. And the only way they could hear about it is through me. I was at St. Charles Community
That's cool.
College last week for a chair yoga class, and I went to give the nurse my card. She said, "Oh, I met you at the community college at the fair." Well, I went
That's
to the senior fair. I was going around just picking up information. So, you know, I love the fact that I'm out there enough that people are recognizing my name or me,
mm-hmm,
and that's encouraging. So I know I'm doing my job and eventually, I'll get what I need. So
mm-hmm.
I'm good with that.
I love it. I love it. I love it. That's amazing. Yeah. Very cool. So yeah. So last question I guess then would be, from an ordering perspective. Oh, nope, there's one other question that came in. Okay, we'll start from the ordering perspective though. Um, how do you recommend, so let's say somebody's like, yep, we need to buy 5 of these thingies,
Mhm.
how do they connect to you, or like kind of what's that process, and then how do they order? Does it get shipped? Do they pick it up somewhere? Like, how does that go?
So here's what I've been telling people that are referred to me, like from you. They would go to the website, they can look at the pants, see the price, and they can call me if they're local. I will meet them at a police station or somewhere safe for them and for me and deliver the pants because the pants are approximately $10 to have them shipped for a pair of pants. So if somebody wants 3 or 4 pair of pants and they live here, I can meet them in the community with the pants. They just have to call and not order online. If they order online, I'll ship them and they'll have to pay the ship fee. But if they go directly through me, then I can make arrangements with them. They would pay for the pants and I would meet them somewhere in the community, preferably at a police department.
Okay, that is good. And they can just like use a card or something like
Yeah,
this to pay you. Okay.
online they would. They can pay with a card online.
Okay, sounds
And
good.
it's an easy checkout. It's for seniors, so I made it easy because I'm not savvy with the technology. As I confessed, I had my daughter here the first hour just so that if I had anything wrong with my Zoom call, she could fix it. But I did tell her she could leave, and she did. So, but it's very simple online to be able to order the pants, and they can always call me and ask questions as the man did from Ohio last week, a couple weeks ago.
Okay, I like it. And what's the return process, just in case, again, like if 5 foot, to me gets, whatever, and I'm like, oh, these are way too huge. And I will say this too, the thing I love about, the material that you have going on also is it looks like, I mean, they could easily be hemmed. The material
Oh,
looks like
absolutely.
super user
No, it
friendly. Yeah.
can.
So you could
Absolutely.
totally, kind of get whatever length and
Right.
cut them and hem them up and, be done and just get them,
Uh-huh.
right to the size you need potentially
Right.
also. But
So with the return policy, if the pants are worn, they cannot be returned because of the urine,
yeah,
because of the sanitation of the
yeah.
pants if they wear them. If the tags are still on there and they get them and they say, "Oh, I don't think I can use these. I don't want them," they can return them back to me. They can just ship them back to me and let me know. And then once I get the pants back, I can send them the refund. But I encourage everybody, I wouldn't want somebody to order 5 or 6 pair of pants. I would say order 1 pair, make sure it's what you want, and then order multiple pairs of pants. Most people that get the pants say they need more than 1 pair, so it may be 2 or 3 pair down the road that they are eventually getting. But my
Mhm.
encouragement would be if it's an agency and they want to, order 10 pair of pants for the people that they serve within their community, that I can deliver those to them so that it would save on shipping for them. I can deliver that right to the communities. I don't have a problem with that. The rehab centers, any agency, I can deliver it directly to them. It's just the individuals. I want the parents, the people that I, get the pants to. I want them to feel safe with me approaching them, but I also want to be safe with them approaching me.
Mhm.
My
Yeah.
spring chicken days are over. So I want to be safe and that's a big factor for me as well.
Absolutely. Yeah. Okay. And the last question we got going on is, from like a takeaway standpoint, what would you like, caregivers or families, providers, to be able to just, take away just in general from today from you?
I would say the takeaway for today is to know that I'm a resource and an option for them if they need this. It's not for me to try and push and sell anything on anybody. I just want the word out because there are a lot of people out there that could use the product that we have created and patented, but they don't know about it. And I'm out there on Google. The man that I spoke with a couple weeks ago, he said, "You were the fifth person down." And I laughed. I thought, wow, I don't know much about the algorithm, but it must be working back there. So I thought that was interesting. And it's that's the takeaway. It's a resource, it's an option, and it's information. And that's all I'm trying to do is to inform people about something that I was able to invent and create by working with my dad and seeing what he was doing with his scissors that he shouldn't have had. So
Back to their fall risks
back to those,
anyway.
yeah, I might have to repent about my thoughts when I hang up because they were not good thoughts.
Yeah, I was like, you're fired as a caregiver.
Right.
Where's the safety first? Yeah.
Right. His hands were okay, his just legs weren't. Oh
That's
man.
so cute. I love it. Well, thank you so much for
Well, thank
joining us
you.
and sharing all this
Absolutely.
today. This is so helpful.
Thank you.
And yeah, like
Thank
I
you.
said, we're just excited to help you, continue to get the word out. And if I
Thank
can
you.
help you and make any kind of connections for you, I think that'd be great. And there's just so much I learned, even
Oh,
like
thank you.
from like, yeah, if someone is going, with just their caregiver or, like one of these transportation services to the dialysis stuff. And then they have an
Mhm.
accident on the way there. The dialysis people turn them away. And like, good grief, how many times a day does
Oh,
that happen? I'm sure, like,
right.
holy moly,
Right.
and then it screws up the dialysis schedule, it screws up all kinds of everything,
It
and it's
does. The caller
crazy
ride, because most
expensive.
people are going and caller ride,
Yes,
or Uber or whatever. These some of these people have to go to dialysis 3 to 5 times a week.
absolutely.
And a lot of them are traveling by themselves.
Hmm.
So
Super,
it's something
super
to think about.
impactful. Yeah,
Right.
absolutely. So, anyways, but yeah, thank you. And yeah, like
Thank
I said,
you.
any way we can help, let me know. But yeah,
All
hopefully
right.
we'll get this out there for you and yeah, get you going. And and hopefully when we talk next time, like that was so cute. I'm like, well, what do they do when they need to order? You're like, well, if they have questions, call and I'll answer because I'm available.
Right.
I'm like, the
Yeah.
idea is to have you so busy you ain't available.
Well, it
That we'll
is,
have
but
people
even
for
when I'm
people to
so
answer,
busy,
but
I'm gonna
yes.
tell you, when I'm so busy that I can't
Yeah.
answer, I'll
Yeah.
call them back. I
Yeah,
will. I've had
absolutely.
a side, my husband and I, we've been married 46 years and we've always had a business on the side. And that business of consulting was really picking up a lot. And then when my dad started having issues, I had to give all of that up. I gave up everything but one consulting that I do. And it's pretty well known here in the city. But I gave up everything but that because I did not want to have a group of 5 people or 500 people in a room waiting for me to come and deliver a presentation. And my dad's calling on the phone, "Oh, I've fallen and I can't get up." Okay,
With the
great.
scissors.
Well, that means, Poppy, either you have to sit on the floor for the next 2 hours or I have to cancel this meeting. So I didn't want to ever put myself in a position when I said I would be available and could not be. So this is going to take the place of what I gave up for 15 years.
Yeah. Well, that's beautiful. And just a testament, yeah, again, like just to your heart and who you are and just, your love for being able to serve and help problem solve and figure these things out for people. And I love that. Yeah.
Well,
So
thank you.
kudos to
Thank
you.
you.
So
Thank you. And you have a
awesome.
great day.
You
Thank
too.
you.
Thank you.
Bye bye.
Thank you for joining us for this discussion on bladder health and incontinence in older adults. So, urinary incontinence, let's talk about what is that in the first place. So, Urinary incontinence is basically the loss of bladder control, but you can also have bowel incontinence too. And so bowel incontinence would be if you had like loss of function of like the bowel area. But collectively together, especially bladder control and urinary incontinence really affects like millions of older adults and can really have a significant impact on daily life for these people. So, while many people believe that incontinence is just simply a normal part of aging, that's not entirely true. Though aging can obviously like increase the risk, there are often specific causes and other treatments that can help to like improve the symptoms and also, again, the person's quality of life. Like we learned from a quality of life standpoint, like with the easy pants, like Angela talked about today. There are solutions, that sometimes that are out there that are easy, to implement that can help. So let's begin first, though, by discussing some of the common causes and risk factors also for incontinence in adults that are older. So, as we age, just our bodies naturally undergo changes that can affect our bladder function. So, age related changes in bladder capacity might look like, decreased muscle tone and decrease sphincter control. And what that basically means is like the body's ability to be able to have that like good tone in the bladder or sphincter, essentially to be able to hold like the urine then correctly. So when those get lax or, reduced tone in the muscle, of the bladder, et cetera, it then reduces the body's ability to be able to hold urine effectively. So the bladder then essentially may not hold also as much urine as it once did. So those muscles that help control urination then will weaken over time. So also with that being said, besides like, the sphincter tone being able to like, hold everything tight, and then release, for the actual like urination to be able to happen, etc. What can happen as well is that over time, the actual walls of the bladder itself, because the bladder is a muscle, right? But the walls of the bladder itself too can actually atrophy as well. So basically, like think about it in terms of like we're going to talk about like your stomach. Okay, so when you eat something, you're full because you have little like nerves and receptors in the walls of your stomach lining that as you put more food in, then it will stretch your stomach lining, and then those nerves send signals up to your brain like, okay, yep, we're good. We are stretched to max capacity. Like, can you please tell her, to stop eating peanut M&Ms? Just kidding. Anyway, but, maybe something healthy, broccoli. No. Anyways, but it goes up and tells your brain the signal like, okay, we need to shut this down because we are stretched to like max capacity. But what happens sometimes then, especially like in the bladder as we get older, sometimes like those stretch, we'll call it the stretch signals, that whole stretch and signaling pathway gets a little bit diminished. So also too, the ability to stretch also in the actual muscle itself can also be diminished too. So sometimes, like you used to be able to hold a lot more urine, but as that muscle atrophies, like you might only be able to hold this much volume of urine before, you start signaling your bladder's like, okay, I can't do this anymore. I got to pee, or you got to go. And so anyways, that also can be a difference then sometimes like in incontinence. So, again, for some people, they can only get like this full before it starts signaling, I gotta pee. So then, then you have to go. We see that frequency, right? So people have to go a lot more frequent. We see that urgency. It's like, oh, oh, okay, now, I gotta go like right now. So you'll also see that urgency sometimes as well. Just again, as the pathway sometimes just isn't isn't as brisk with, the signaling getting there like it used to be. So sometimes, there can be a little bit of delay. But with that being said, too, I just want to make you guys aware, that again, sometimes, like, again, as you age, we're gonna have these natural changes that just happen in our body, yay. But also there's certain other chronic health conditions that can increase the risk of incontinence happening too. So those things are going to be, any kind of like kidney kind of issues or like diabetes. Also, if somebody has a stroke, even like arthritis kind of things sometimes, or neurological disorders for sure, things like that. Things that are also going to affect, again, that nerve signaling pathway, right? Mobility, again, if somebody like can't get, up or down, or they kind of have like decreased function in their body overall, or decreased muscle function involved in that bladder control, you're going to have more issues. So again, arthritis sometimes can make it difficult for people, like let's say they have like hip pain, knee pain, which are very common, for people that are aging, but arthritis can make it tricky for somebody to be able to realize, like, okay, like this part could even go totally fine. Like, okay, bladder's full, normal kind of full, send the signal. Yep, we got to go to the bathroom, comes back down. But then again, if somebody has a lot of hip pain, knee pain, it's going to be painful. They just can't spring up out of the chair and like run to the bathroom quick, fast, and be able to relieve themselves. So they're going to be a lot more slower because everything's going to be a lot more painful. So again, while neurologic conditions can interfere with that, the actual communication, it doesn't, like, again, it just doesn't fire like it should, those signals. You can have, things like, physical constraints, again, like your arthritis, et cetera, that can make it tricky. Other things like diabetes can contribute to increased urine production or like nerve damage that will then, same thing with kidney stuff, then, too, that can affect that bladder function. So another important factor to consider as well is medication use. So certain medications, including like diuretics. So a lot of times when people are older, they get put on, you hear the term Lasix, right? So they get put on Lasix or diuretics that help them to be able to increase their urine output and urine production so that they can get the fluid drained off their body, so that they don't get leg swelling and pressure swelling around their heart, kind of lungs area, etc. So that's a common thing as people get older. We'll see, like I said, the diuretics come into play, but also like sedatives, sometimes even antidepressants. But you can also, have different things like that too, again, that will increase that urine output or affect like bladder control just as a side effect. So if someone starts noticing changes in bladder function after starting a new medication, absolutely make sure you speak with your healthcare provider, and also the pharmacist as well. So healthcare provider, doctor, obviously that prescribed it first, but sometimes too, again, that pharmacist might be able to give you insights as well, if that is, a typical side effect that can happen with that medication. And a lot of times, again, we're going to see just that increased urgency, or increase like frequency, right, of when somebody's like going to the bathroom. So now that we've discussed some of the causes and risk factors, just really quickly, I want to touch on this for you guys too, to talk about like strategies for managing incontinence, right? So one of the first approaches often involves, again, lifestyle changes and diet. So again, the easy pants would be an example of a really cool, lifestyle change. But also from a preventative standpoint, it's important, like reducing alcohol consumption, caffeine consumption, etc., can help to decrease bladder irritation, because sometimes, things like that can just like irritate the bladder lining and will make kind of like psych your brain out, if you will, and make you think like, okay, you got to go to the bathroom like a lot more because it's just irritating. And so it'll kind of like cause like that over signaling and irritation, kind of an inflammation. So staying hydrated is important also, but some individuals may benefit from adjusting fluid intake throughout the day, again, under the guidance of healthcare professionals. So Again, if you're working like with a heart doctor, a kidney doctor, anything like that, you want to make sure to ask them, or a dietitian, nutritionist, etc. You want to make sure to ask them like how many ounces of fluid a day, is appropriate for you to be drinking. So maintaining a healthy weight also can help reduce the pressure just on the bladder and pelvic floor muscles in general. And also, again, like making sure, that you're doing regular physical activity, and just moving, getting blood flow around may also help improve like your mobility, and independence, but doing pelvic floor exercises. I'm sure you guys have all heard of the Kegels exercises as well, but can help to like strengthen and support the bladder and help improve bladder control. And fun fact, Kegels are actually beneficial for both men and for women as well. And, a lot of times they're recommended as a first line of treatment, if you will, for somebody who has incontinence. And for men, like I think a lot of people, also don't realize too, like for women, the more births that women have, like that are actually birthed vaginally, not like C-section, that can increase a woman's incontinence risk, a lot. And so usually we'll hear like, okay, you need to do Kegels post, when you have a baby. But for men, also, men can have prostate issues that, like benign prostate issues, BPH, etc., prostate cancer, different things like that for men will absolutely also affect their bladder control. So both kind of sides of the coin that people, just need to pay attention to. But, I think overall, again, family members and caregivers, etc., offering support and basically helping to kind of reduce the stigma and just open the conversations amongst themselves and with healthcare providers can really make a meaningful difference. And compassionate and respectful approaches really help to preserve, the dignity for someone and encourage individuals to actually seek help when they need it. So anyways, yeah, just different kind of topic, but again, being able to provide, even like absorbent pads, protective undergarments, adaptive clothing like the easy pants, etc., can really allow these individuals to continue participating in the activities in life that they really enjoy. And I think at the end of the day, that's really what it's about, is helping them maintain that independence and comfort and just quality of life really at like every stage of aging for someone. So anyways, I just want to thank you guys for taking the time to learn more about, bladder health and incontinence and just really increasing the awareness. And, thank you for Angela and sharing her amazing resources so that we can continue to help supporting these older adults, and people with disabilities to live a more full and, just adventurous life in a more certainty and confident kind of way. So thank you guys for joining us.